seminar sponsored by the University Professionalism Committee and the Student Affairs Academic Deans. The objectives are to define and clarify appropriate academic conduct and to clarify consequences. So we're gonna have the faculty come up and the academic deans come up and talk a little bit about what happens. We use the policy 7.1.3 era, and it's student conduct and discipline, and it's currently under revision. But what happens is the faculty member refers an issue to student affairs, and the student affairs representative interviews the student based on documentation supplied by the faculty. And then the student acknowledges the behavior, in which case the academic affairs representative assesses a penalty. The student denies the behavior, then there is a formal hearing. It's an academic integrity hearing, and it's 3 faculty members, 1 from the school where the student is enrolled and 2 from 2 other UTMB schools. So I represent the School of Nursing. So I had someone who denied the allegation. Then I would get in contact with the other academic, other schools, and two people from, maybe 1 from the School of Medicine or 1 from GBS or 1 from health professions would be part of that panel who would review and have that hearing. And then they would make a recommendation. The chair of that hearing group would be the faculty member from the school where the student is. So we have representatives from each school, and Dr. Copenhaver, who is the Associate Dean for Student Affairs in the School of School of Biomedical Sciences, will be the first person who speaks.
Thank you, Tina. So, talking about academic conduct and discipline, everybody knows what is liable to get you into a discussion about academic problems. In the graduate school, it's most likely to be something that is related to plagiarism, usually a misunderstanding about what the rules are. In some of the other schools, it might be actually cheating on a test. It could be fake in the graduate school. It never has been, but it could be faking experimental data or making something up. But anything involved in the academic process, involved in what you're doing to get your degree, that isn't quite kosher. Dr. Cuellar told you a little bit about the process that goes through, and I want to spend my few minutes talking about the first part of that, the informal process. She said that you could agree to what you did, and then you could get taken care of. It's actually a little bit more complicated than that. If a student gets referred to me, either by another student saying something's not right, or because we've checked something that they've handed in with plagiarism software and something doesn't look right, or a faculty member has said something, the first thing that happens is I call them into my office and I say something has come up, this is what's come up, and we talk about it. Oftentimes it's a misunderstanding, but then I'll say, before we go too much further, I want you to know that there's 2 ways that things can be handled at UTMB. One is the formal process, which goes to the panel that Dr. Cuellar decided to talk to you about. The other is the informal process, where if you're in the graduate school, everything gets handled in my office. And what we do is we go over what has been alleged, what has been found. We talk to the student, and I come up with what I call a finding of fact. This is what happened. The student can agree to that, and then that part never goes to a panel. So basically, what I try to do is figure out exactly what happened, exactly what the circumstances were, and I'll tell you, in all my time as a student affairs dean, this is the only way I've ever handled anything. I've never gone to a formal panel. So the students will say, we agree on what happened. It's written up. They get it in an email. They sign it. They actually sign it before they go out of my office because I take notes as we talk. And then I say, okay, the informal process now has another part. Something is going to happen. I mean, if something happened, if the finding of fact is that something actually happened, it wasn't just a misunderstanding, there is going to be a consequence. And the student then again has the option of saying this consequence is going to be done in my office, or it can go to a formal panel, the same formal panel before, but this time they don't talk about the finding, what happened, they only talk about what will happen. And this is the point where you really try to understand the circumstances, because sometimes things are cut and dried, something was wrong. Sometimes things are a misunderstanding. Sometimes people come from different backgrounds where different things are considered standard practice, and you can look at something as part of a learning process. And the students invariably will say to me that, oh, Dr. Copenhaver, whatever you say is what I'll do. And I assign something, they sign off of it, and it's over. Now the penalties from either process run the same gamut, and they're what's laid out in the policy. And if you read the policy, you basically see that the possible penalties range from don't be a bad boy again to off with their head. You can do anything from give a warning to throw you out of school to post hoc you can revoke a degree, and that has been done at this school. So there is actually no statute of limitations on academic dishonesty. But my strong feeling is that if you're ever in that situation, which I hope you won't be, that you trust your student affairs dean, talk with him or her about it, let them know exactly what's happened. I know they all have your best interests at heart, and they will take the whole situation and try to figure out the equitable way to go forward for everyone. That doesn't mean that you never get something unpleasant if you actually did something wrong. But it does mean I'm quite confident that it will be fair. Any questions?
So anyway, I'm John Nolstein. I'm chair of the respiratory care program at the School of Health Professions. And I really have to add a disclaimer here. I'm here just to represent the school. I'm not an academic dean. I'm not a dean of students. So I was asked by Dr. Henry Cavazos if I would take his place because he couldn't make the luncheon today. So I've agreed to do that. I do have a role that is somewhat related because I'm chair of the Grading and Promotions Committee for our school. And that's basically a committee of the chairs, but we review all of the academic decisions that come up at the end of each semester. So those kinds of decisions are related strictly to academic issues, but we make decisions about academic probation, academic suspension, extended graduation dates, so permitting a student to take another semester to complete some additional coursework, and also then decisions about academic dismissal. And generally, the relationship between academic decisions and decisions that the Dean of Students make related to integrity issues are for the most part separate issues, but I'd have to say that there's a high degree of association. So if there's something that's gone wrong with the academic integrity piece, most of the time it's because the student is struggling with academic issues and they're trying to survive. At least that's my perception. And I think more frequently what happens is there may be an integrity issue, there may have been some penalty assessed, but then the student doesn't end up staying because of academic reasons. They flunked the course or were suspended or some other academic reason. So most of the cases that I'm aware of in the school ended up with some sort of academic decision being being made rather than, or the student being dismissed for academic reasons rather than reasons for academic dishonesty. So I can't really speak for Henry in terms of how he makes his decision process. I'm familiar with how the process goes, but how he makes the decisions on the severity of the treatment following an academic dishonesty issue. But I can tell you, just in terms of process, the issue of academic integrity and the professionalism code is discussed at orientation. So students get advised of it. Hopefully you'll understand them, help them understand what those issues are, help them define it, so that they know what they need to try and stay away from. From a faculty perspective, we also try to have some training session each year for faculty that's presented at the Faculty Governance Organization to help explain to faculty what their role is and what the process is that they need to follow, which is basically if something happens that they're suspicious of, then they don't need to take specific interaction at the time other than to report the instance to the Dean of Student Affairs. And the Dean of Student Affairs then takes the issue on from there. If there are academic issues, then later on it comes to our group, the Grades Promotion Committee. But otherwise, we really have those 2 training sessions a year, and from my perspective, all of the academic integrity issues as they arise, they go to Henry's office. I usually don't hear about them unless that it involves one of my students. But again, of the cases that I know of, I think all the ones that I can think of ended up in the long range being academic decisions. So even though there was some sort of correlated or commingling of those 2 issues, if in the syllabus there are statements that say, for instance, attendance or your performance in the clinical setting is based on certain types of evaluations, even though affective evaluations have certainly a relationship to academic integrity, if there are formalized documents that evaluate that process, then a student could be dismissed from a course if it's in the syllabus and says what those particular issues are. So there are, on the academic side of things, there are sort of affective traits that are related to integrity that, if they're in the syllabus, could result in dismissal or scholastic probation. If it's an academic issue, there's really a couple phases, because the first phase is with the faculty. If the student objects to whatever grade or whatever decision the faculty made, they can challenge that. The next step is it goes to the Gradings Promotion Committee, which, as I said, is a committee of the chairs that I chair, and we make a decision. Then the student can appeal that decision, and then sort of same kind of process. There's a formal process that involves appointments of representatives from the other programs, faculty representatives and student representatives, and they meet to resolve that issue. If the student is still unhappy with the decision of that appeal, they can still make a final appeal to the dean, but the final appeal to the dean is final. So that's where it stops. After the dean has reviewed all the materials and made a decision, you can't go to the president or someone else for another opinion. It's like, that's it.
I'd like to introduce Amr Purwell, who's our attorney. He's this university attorney. Sometimes when we review decisions about academic integrity, we need to consult with Mr. Purwell to find out all of the ramifications of what goes on in making a decision and how to handle the issue. Sir, would you kind of...
Everybody hear me? So as I mentioned, you'll probably never talk to me, and the reason for that is because I represent the institution. But I think they wanted to include me just so you guys know that they're not alone in interpreting our policies either. So, as they're going through the process, I help them kind of explain, and it is under review. If you guys take a look at it, 7.1.3. It's a little bit hard to read right now, but probably early next year you'll have a cleaner version. So that's really it. I don't know, don't cheat. So.
Allison O'Donnell, and I'm a physician in the Department of Family Medicine, and I'm co-chair of the Professionalism Committee with Dr. Rebecca Saavedra, who spoke earlier. And I am a long-standing small group teacher. And I realized as we were going on, there was a lot of talking to you all, and there was quite a bit of eating, but not as much participation. And so I'm going to change the sequence just a little bit here, and I'm going to have us do a case, and then I'm going to bring the School of Medicine and the School of Nursing with their policies. But the reason we're having this is to get you all as students to think about consequences of behavior. And we're talking about academic integrity, okay? And we have a new professionalism charter, and I just want to remind you all of the honor code. On my honor as a member of the UTMB community, I pledge to act with integrity, compassion, and respect in all my academic and professional endeavors. So everybody signs that on our campus, or not signs it, but talks about it, including all of the new employees, everyone. So I'm going to get you all at your tables to think about scenario 2. Could be any school, okay? You've made good friends, but this is a bad rotation. This is, everybody on there is really sweating. You're studying hard. Everybody around you is kind of stressed out. Your little small group that you work with, which is about 8 or 10 students, they're all saying, you know, nobody ever told me it was going to be this hard. One of your fellow students and a friend, notice, friend, fellow student, offers you an illegal stimulant to help you study more, help you stay up long nights to do those clinical rotations. Everybody is doing it, don't worry. That's what your friend says. Maybe 2 or 3 others of your friends say that. You think to yourself, because your friend has reminded you, this is just to get me through this stressful time. This is not, I'm not going into this for a lifelong thing. Nobody will know, your friend said. What will you do? So the scenario is you're under stress, your good buddy offers you some medication, which, as you understand the medication, will probably, we could use the term speed. I mean, my discipline is family medicine, so I write a lot of legal prescriptions for people who have attention deficit disorder. But what would you do?
I am the senior faculty advisor in the School of Nursing. I used to be the associate dean for student affairs. And I decided that I wanted to do a little less work. And so when I opted to do a little less work, the dean decided that I should continue to do student disciplinary actions, which is not a little less work. So in the School of Nursing, we do similar things to what you heard from the School of Health Professions and Graduate School of Biomedical Sciences. However, I've been fortunate, just like Dr. Copenhaver, I've never had to go to a formal hearing. I do a thorough investigation. I've become very close friends with Mr. Perwell. I know his voice on the phone because we talk frequently. We have close to 800 students in the School of Nursing, and as that you can understand, there are issues that come up periodically. And I get the student in and I do a thorough investigation. I feel like when I get a complaint, I need to hear all the sides. I need to hear from the people who are making the complaints as well as the person who's been implicated. And I talk to Mr. Perwell, make a decision, talk to the student, and tell the student these are your options, and this is what we want to do. Most often the student owns up to what the behavior is, and we take action. There, as Dr. Copenhaver says, we have gone from this is a slap on your hand, don't do this again. If you do it again, things will be really worse, to you are no longer a part of the school. And so you need to really think about what you do when you do things and what the implications are. So these scenarios are pretty much realistic from the university. We've disguised them so that you don't know which school they've come from, even though it might say a school. But these are issues that have really come up. Do you have any questions?
You know, as long as you don't need or recognize you need help, you probably don't have any questions. But trust me, if you found yourself in the situation of this person that we're going to talk about, you would probably want some help, whether it was the help from a dean or, you know, your best faculty mentor or someone, an ethicist if you have somebody, because some of them are ethical problems. So let me ask my little group right here, what do you all think? One is, what would you do? You know, and maybe this group over here would say, well, why would you do it? Okay, but let's go. Tell me, talk to me.
Use it ourselves.
Okay, go ahead.
So we decided that stuff's bad for you and we wouldn't use it ourselves. And I'd offer to drive everyone to Starbucks for coffee instead.
Oh, so this is great because you've offered what you would do and then you've offered a solution to the situation. Okay, so coffee is used a lot. Okay, it's bad for you. It's not illegal. Any other ideas? So it's bad for you, you're not going to do it, you're going to offer an alternative. How about my group back here? Are any of you all first or second year students? How many are first or second years? You're all second years. So do I have a third or fourth year student? I know I've got one because he's actually working in the department. What would y'all do?
We would refuse and then tell them, remind them of the bad things that illegal substance could do.
Okay. You know, when I hear that, I'm in clinical practice, and 3 times today I reminded patients how bad food was for them because they were overweight and their blood pressure was high and their cholesterol was up and their sugars were high, and you know that doesn't work real well. Just reminding them. So you got to remind them to start off with, but we want some other strategies. Okay. What's the consequence? This is tough. What's the consequence for you who offered her the amphetamines? Anybody got an idea? Is there a consequence? That is illegal. You are giving a prescription, not just any kind of drug. It's not like you're given a diuretic so somebody can lose a pound or 2 to get in their wedding dress. That was probably sexist. but that's illegal. And in my practice, when I prescribe the stimulants for attention deficit disorder, I explain to this person I'm giving that to the consequences of if they give it to one of their, and particularly for us in health professions, you know, it's there. So there are consequences. Yes.
One thing we were kind of unclear about was our obligation if we see this happening to report it, or do we just make them aware of the consequences and then let them go with it, or what do we do?
Okay. Now is the time to get Dr. Rayback up here.
One of the things that you need to think about in this scenario is that we have random drug screens. So that adds another point to your statement.
I was introduced, and thank you, Dr. Cuellar. Apparently, Dr. Cuellar faced this very same thing and chose to step down his dean instead of take drugs. So she made the right choice, I guess. Well, just a couple things. Following up, actually, on this last scenario, I think most of what all of our schools do technically, or the standards are the same. So not a whole lot. I'm not going to repeat what others said. I want to try to add some things that I think. And in relationship to this last scenario, I don't know how many times I've gotten, I have heard that, or we all know that. So I heard that they cheated on that last exam. The fraternities, you guys can add whatever you want. Or, you know, I heard that, you know, first years are doing this thing on the Facebook page, I think it is. Okay, so a lot of the things that we get are not necessarily, you know, it's introduced by, you know, faculties bringing this to us. I think a lot of the stuff that I get are students coming in. And, you know, in maybe a way this is a challenge to you, because when you come in you say, well, we all know that, or we all heard that, or you go on Facebook and see this, which I can, see all that stuff. The problem is nobody ever wants to go beyond that. So, you know, we get stuck with and just like everybody else, our first things is to bring everybody in, to talk to everybody, do our research, but if no one's willing to identify anybody or identify a specific incident, nothing happens. So, you know, I think the crux of the question here was not, oh, I wouldn't do it, but what would I do? Would I identify somebody? I don't know. That's a tough call. Because there are consequences for everybody if that were to happen. Unlike a lot of the other schools, we have unfortunately had to go to the committee on occasion. But I will say that just like every other school, I think, and I think since we've done both, my opinion is that for everybody, it works out a lot better if we can all come to an agreement and an understanding of what happened and an understanding of what the consequences should be, rather than having to go to the committee. Certainly on occasion there is things of such a magnitude that they have to go to the committee, or that, you know, no agreement can be met. But I think most often it works out better. In terms of the consequences, I would say that, you know, we didn't really talk about it, we talked about what they could be. I would say certainly for School of Medicine, rather than off with your head and cut off your hand so you remember, we would try to do something that is kind of related to what happened, and in some way might, you know, be punitive certainly, but also be in some way kind of remediatory. So, you know, rather than just some horrible punishment, so you never think to do it again. So that would be, if there's anything else I wanted to add. Yeah, so quite often what we're going to find is not so much, certainly the easiest ones are generally for us, I think, are the academic problems. Somebody cheated, you know, if there's evidence for that, and somebody's willing to identify who it was, those go pretty well. I think the problem is that quite often no one's really willing to provide appropriate facts. You know, you all can answer that better why that is. Other thing that we see, I think, in medicine, a significant number of more professionalism things than just academic cheating. And so it would be other students, the police, various folks. Yeah, so all that thing can happen. And but there are real consequences. But I think that the take-home message is that we all the schools try to work as hard as possible to find as much information, look at all sides, and then try to come up with some kind of an agreement as to what happened and what appropriate consequences should be. And any questions? I know I draw School of Medicine, so hopefully you'll take that back to your friends and say, if you really want things to change, somebody's got to be willing to say a name.
One of the things to think about is before it happens to you, think about who would you go or who would you feel comfortable to talk to on the faculty? Who is your mentor? Who is somebody you could go to? Because I think in the things that we're talking about, I like to do what I call share the wealth. Get ideas. Talk to someone so that you can, because we all have had different experiences, and we may know, you may come to see me, and I've done this before, and I hear the story and I say, oh, the person you need to go talk to is Dr. Ainsworth or Dr. Raybeck or somebody that I know has dealt with that. Or I just say, who is somebody that you can talk to? So finding somebody that you can dialogue with is good. We started with an easy one, okay? So I'm going to up the ante a little bit. We would all want to have maybe an instructor who is young and that you find him or her attractive. Or maybe you wouldn't, but all of us have experienced that. Your instructor has an open door policy. That doesn't always happen, but it's so wonderful when you find some faculty who are welcoming and they invite you to come in for coffee or talk or whatever it is. You're finding the academic rigors associated with the class to be stressful. Have you noticed stress is in all these cases? So, you know, we'll do maybe a brown bag sometime about non-pharmacological management of stress, something other than Starbucks maybe. But during one of the visits, the instructor closes the door. You know, this could probably be one of those YouTube scenes where you're kind of imagining in your wildest dreams what that's happened, and you know, maybe you would think you might want it to happen, but it does, and now what are you going to do? Instructors let you know that they think you're attractive. Well, hey, so far we're okay. Not only that, you're flattered. I mean, who wouldn't be? You know, somebody who you respect thinks that, you know, but are you getting that kind of creepy feeling? Are you wishing the door wasn't closed? Are you wishing you had a plan A, B, or C for this? Okay. Now, the instructor takes it a step further. You get the idea real clear that probably the next thing that instructor is likely to say is, would you like to meet me at Cafe Mod for a cup of coffee? Or maybe Rudy and Paco's for a super steak and a nice bottle of wine. You don't know, but you know this is not going well. And then you know that this instructor knows that you have had trouble academically, maybe not academically, but you haven't been doing quite so well in this course. And then, this is the double whammy. The instructor pulls a power play on you and kind of implies that if you go out, your grades might go up. And if you didn't, you know, hesitate, hesitate, hesitate. No one wants to be in this position. I hope a faculty doesn't want to be in it, but no student. I can tell you, I'm getting ready to retire, and so I have heard story after story of this. So this is not old news, and it's new news. It happens. Maybe not quite so obvious as this. But, so, what would you do? I've got a table back over here, okay? And this is good because we've got two genders back here. How it would feel like for a male student. And do you all think? I mean, in the old days, when I went to medical school, there were no women. My medical school class had 4 women. So if there's any harassment, you know, for the sexes, that didn't happen too often. Well, that's not true. It happened. But what would you do?
I would try to diffuse the situation as much as possible. You know, I'd probably be pretty forthcoming. Say that's not something I'm interested in. We can keep this a professional relationship.
So 3 things: brought in humor, laugh it off. You know, I mean, y'all were nervous when I presented this. You laughed, but you didn't laugh because I was just a stand-up comedian. You laughed because this is nervous. And when we get nervous, we may laugh. try to diffuse the situation, not go for coffee, okay? Now I'm going to save the punch, which is what are you going to do after you walk out of the room? Okay, so one is you're not going to take her up on the offer, and you're going to let that person know that you were a little uncomfortable with that. Okay, let's see if we got anybody of the other gender.
The what would you do question. Say thank you, but no thank you, and I mean exit the room as politely as possible.
Thank you, no thank you, and exit the room. Quick. That's always good. The quicker, quick in, quick out.
And then after I'd left the room, I would go find, I guess, would it be someone in human resources that I could report the issue to, just so that it would be on paper. And if there was anything concerning my grade at the end that I felt could have been unfair, I could have brought this up to him or to her, whomever that may be, and just to kind of cover my background and my basis.
So we've got reporting, documentation. We have a professionalism site where that can be reported. You can go to your deans. Does anyone else have another solution to this problem? Yes, ma'am.
I feel like I would have told the professor I don't need the help or assistance with my grade if I'm going to fail. I'd rather just fail. And I would take him up on the coffee. If I tell him, you know, I don't need any assistance, but if he's a cool person, why not?
Okay, if he's a cool person, why not? Good. But I'm going to let Dr. Saavedra. Dr. Saavedra? She is tough, so why not? What's wrong with going for a cup of coffee under these situations? Or what are the options? Rebecca?
I think it's a great option. I mean, you just need to stay straightforward and just say, you know, just like you did. I don't have a problem with that. But since we're at the time to end, I just want to, why do we talk about professionalism and integrity? What's the deal? In one word, why are we doing this? One word. Thank you for that. One word. Why do we do this? There's multiple words, but what is one word? Trust. What did you say? It's important. Why is it important? If somebody is cheating and you're in the classroom, what's the problem? Fairness. Equal. If you're in the clinical situation or in the lab and somebody is cheating, what's the problem? Safety. Quality. That's it. I mean, and that's why you have to stand up and say something when you can. Fairness, safety, quality. That's the story. Thank y'all for coming. Really appreciate it.
Hear, hear.